I'm just going to ask you a couple of questions about your job and what you do.
Okay, sounds
Um,
good.
so, how many years have you been a nurse?
Like 13 and a half.
When did you decide that you wanted to be a nurse?
When I went on a study abroad to Israel, I was like the class nurse just because I had had some first aid training and things like that, and I thought it was kind of fun.
Do you enjoy your job?
Most days.
How?
Yes.
What are your hours? When do you work?
I work nights. I work 7 p.m. to 7 a.m. 2 to 3 days, 2 to 3 nights a week.
Yeah, this is fine because we can edit this. So, how long is a nurse's career usually?
If they choose to stay like a floor nurse, they can choose to go on to more schooling and like teach or become more specialized, but you could be a floor nurse for years. I don't know, your whole career till you're 65.
What are some benefits of your job for your family or for you?
Benefits for my family is we have extra income, and I feel like I'm prepared if there would be an emergency. I know how to handle intense situations, and so and I also know how to do first aid and CPR, so I could help in that situation. The health benefits are awesome, and I get to be home during the day, even though I'm like tired most of the time, but I do get to be home with my kids.
Let's see what else could I ask you. Where do you work?
Work at the University Hospital in labor and delivery.
Um, he's gotta be funny. I hope he was smiling the whole time. Let's see what else. Let's see.
Are you filming me right now?
Yeah, but I can edit this out, so it's okay.
Do you want to know like how much schooling?
Oh yeah. Okay. So, yeah. How much schooling does becoming a nurse or a doctor require?
A nurse is generally 2 years of prerequisites, and then the nursing program is 2 to 2.5 years. Then a doctor has their prerequisites, I'm not sure, and then they have to enter med school, and that's 4 years, and then a residency, which can last anywhere from 3 to 8 years.
For labor and delivery, what are the positions that are needed for a baby's delivery?
So a registered nurse, which is what I am. There's an MA medical assistant that's usually in the room just to help with tasks. And then a doctor, an obstetrician, I should say, to deliver the baby. And then if there is a complication with the baby, you'd need either a respiratory therapist, and then we usually have a NICU RN, a newborn ICU registered nurse, and a pediatrician there just in case there's problems.
How often do you think women usually have to have C-sections on their babies? And how does that depend on, how can that happen?
There are a lot of different situations. I'm not sure of the statistics for C-sections. I want to say annually in Utah, I want to say it's like 23%. Not 100% positive on that, but it's around 20% of women need to have C-sections. And there are a lot of situations. The baby's tracing the heart rate could look bad, or the woman just doesn't progress in labor, or the baby's the wrong position to come out. If the mom is too sick and can't tolerate labor, we try not to have C-sections if possible, just because it's a little more dangerous for the mom. But
what are some delivery related diseases that can come about when giving birth to a baby?
To the baby or to the mom?
To the baby.
To the baby. There's one, if the mom has a fever during labor, there's this, it's called choreo. And that's when there's an infection in the amniotic fluid and the baby could get a fever, get septic, so they'd need to start the baby on antibiotics. If there's like a birth, like if the baby were not to have oxygen for a while, the baby could have cerebral palsy or just delays in learning and development in that sort of sense. I think that's about, as far as like birth related, and if the baby's hard to get out, they could have a broken shoulder, like a broken collarbone, if they needed to break if it broke trying to come out. I think that's about, those are like probably the main ones.
Okay. Is there a statistic on mother-related death in birth?
A statistic? It's very low, but I'm not sure of the statistic. But it does happen not very often, though.
Are there certain reasons why that does happen?
Mm-hmm. The mom could have a lot of bleeding after delivery or during delivery. That's probably the highest cause. They could have like a stroke if their blood pressures were too high. There's a severe but very rare complication called amniotic fluid embolism that can happen. And that is when part of the amniotic fluid somehow gets into the mother's circulation system and kind of blocks it off, and so it doesn't allow the heart to beat.
Right. Let's see what else.
Do you want me to put him somewhere else?
No, it's fine. He's fine. He's been pretty good, I guess. He's been smiling the whole time, so it's okay.
No one's gonna listen to the interview.
Yeah, I know, it's okay. I don't know. It's kind of tough because asked about.
Do you think that was 6 minutes? Probably not, huh?
Well, it's 8:18 right now.
Oh, 18. Oh, I'm sure.
But I've been pausing. So it's probably around 5 or 6.
Am I giving good answers?
Yeah.
You're trying to get Nick's attention.
Are you authorized to prescribe any medications to babies or to the mother?
No. Doctors write the orders and then I carry them out.
What does your job do in the room? When you're in the room, do you just supervise, or is there certain things that you need to do to help the midwife or?
There's certain things that we need to do. If I'm a staff nurse, usually I am a charge nurse, but if I'm a staff nurse, then I will help the patient get in position to deliver her baby. I try to keep the monitor on. And once the baby's, do you want to know like after the baby's delivered or during labor?
Both.
Both. So during labor, I'll monitor the heart rate of the baby and then watch the mom's vitals, of course. And if the mom is in pain, I can help her get an epidural or give her pain medicine, or if she does not want any medication, I support her while she's doing an unmedicated birth. Like do different counter pressure, help her get into the tub, or different things like that.
What's an epidural? Can you explain an epidural to me?
An epidural is an injection. It's kind of like an IV that's put into your back that has like a tube that goes is connected to a machine that is always giving medication to help keep you comfortable. It goes into the epidural space of the spinal column, and it's down low where the spinal column branches off into all the little nerves, and so the medicine will bathe all those nerves and make from about your just below like your diaphragm down to your toes feel numb, so you're comfortable. You don't feel any of the pain of contractions.
And so, can you finish on what you were saying about?
Yes, so I help the woman go through labor, and then once the baby's delivered, we give medicine to help the uterus clamp down after the baby's out. We help if there's a repair that needs to be done, we get the supplies for the doctor to help them do that. We make sure the baby's doing fine. There's a lot to do right after. If the pediatric team's not in the room, then we weigh the baby, measure the baby, give the baby his APGAR scores, help them breastfeed, and do their assessment. And then if I'm a charge nurse, then I do supervise. I help the staff nurse get her tasks done. I'm just an extra person in the room. And if there's an emergency with the baby, say the baby doesn't come out breathing well and they need to transfer the baby to the newborn ICU, then I'll call the newborn ICU. I'll help them move the baby. Or if the mom ends up bleeding a lot, I'll go get the medications needed to help stop the bleeding. There's just a lot of different things that I do.
All right, well, I think that'll help everyone who's deciding on what they want to do for a job. I think that'll help them sway towards a nurse. And so, thanks for your time.
Welcome. Thank you.
Yep.